You already feel it. Groceries cost more, rent keeps going up, your paycheck buys less every single month. You are not imagining it. But here is the part nobody is talking about. The people who figured that out first are not complaining about it. They are not posting about it. They are quietly doing something about it. Something permanent. And the number doing it just hit a record high. Who are they? Keep watching because the answer is not what you expect. Something is happening in this country right now that the people running it are not tracking. Not because they missed it, because tracking it would require them to explain it. The people leaving are not who you think. Not the struggling, not the broke, not the people with nothing left to hold on to. The people leaving are engineers with six-figure salaries, pediatricians, software architects, couples with careers and kids and mortgages, people who by every measure were winning at this. And they are gone. Not on vacation, not taking a break, gone. I want to start with one number because everything that follows lands differently once you hold it. 21%. That is the share of Americans who told Gallup in their most recent annual survey that they would permanently leave the United States if they had the chance. 1 in 5 Americans. And here is the detail that makes this number even harder to brush off. It was not measured during a crisis, not during a pandemic, a recession, or a political meltdown. It was measured during the holiday season, the time of year when people feel most connected to home, when the pull of family and tradition is at its strongest, when every emotional anchor you have is pulling you towards staying. And still, 1 in 5 said they would go. Now hold that number because I'm going to give you the next one. Among adults under 30, it jumps to 24%. Nearly 1 in 4 young Americans, people who have not even finished building their lives yet, have already concluded this is not the place they want to build them. That is where we are right now, and most people have absolutely no idea because nobody has lined these numbers up in the same room at the same time, until now. The IRS tracks the people who make it official. In 2024, nearly 5,000 Americans formally renounced their citizenship. And this is not something you do on an impulse. It requires an in-person appointment at an embassy, a fee of over $2,000, and the permanent legal severance from the country where most of them were born. 5,000 people looked at that process and said, still worth it? But here is the thing. Those 5,000 are just the ones who filed the paperwork. The United Nations estimates the full American diaspora living abroad now sits at close to 10 million people. 2 decades ago, that number was 6 million. The rate of growth has tripled. This is not drift. This is not a lifestyle trend. This is a directed movement of the country's most capable people, and it is accelerating. So, the question that actually matters, the one nobody in power is asking out loud, is this. What do all these people know that the official story is not telling you? The answer is never just one thing. What is driving this exodus is a convergence, multiple systems failing at the same time. Each one serious on its own, but stacked on top of each other, they form a pressure that the most mobile, most resourceful people are simply no longer willing to absorb. There are 5 of them, and by the time I walk you through all 5, you will understand exactly why the people who can leave are leaving, and what it means for the rest of us who stay. To understand how an entire generation of high earners reached the point of packing their bags, you have to look at the economic blueprints laid down decades ago. The exodus happening today is not an anomaly. It is the predictable outcome of structural decisions made in boardroom meetings, legislative chambers, and federal agencies over the last 40 years. The trap was built slowly, piece by piece, through specific legislative shifts, altered regulatory frameworks, and monetary policies designed to prioritize asset inflation over labor value. The foundation of the current crisis traces back to the late 1970s and early 1980s. In 1978, an obscure amendment to the Internal Revenue Code created Section 401(k). Originally intended as a tax shelter for executive bonuses, it rapidly transformed into the primary retirement vehicle for the entire American workforce. Over the next 2 decades, private corporations systematically abandoned traditional defined benefit pension plans, which guaranteed fixed lifetime income for retirees, in favor of defined contribution plans. By transferring the financial risk of market volatility entirely onto individual employees, corporations cut long-term liabilities while tying the financial security of the middle class directly to Wall Street performance. Currently, the Tax Reform Act of 1986 radically altered the corporate landscape. While it lowered individual tax brackets, it eliminated key deductions for middle-income workers and began a decades-long trend of incentivizing capital gains over earned wages. Between 1979 and 2022, productivity in the United States grew by roughly 64%, while worker compensation grew by less than 15% after adjusting for inflation. The economic surplus generated by American workers was no longer flowing into paychecks. Instead, it was redirected into corporate buybacks, dividend payouts, and executive compensation packages. In 1982, the Securities and Exchange Commission passed Rule 10b-18. Prior to this rule, open market stock buybacks were widely considered a form of market manipulation. Rule 10b-18 created a safe harbor for corporations to buy back their own shares without facing regulatory scrutiny. The result was transformative. In 1980, S&P 500 companies dedicated a negligible fraction of their profits to buybacks. By 2023, S&P 500 companies were spending over $800 billion annually on share repurchases. Capital that once went toward capital expenditure, research, infrastructure, and employee pay was systematically diverted to inflate share prices, benefiting institutional investors and executives paid in stock options. While corporate capital was redirected toward market optimization, the safety nets that made middle-class life sustainable were restructured or dismantled. The deregulation of healthcare in the late 1970s, combined with the passage of the Health Maintenance Organization Act of 1973, laid the groundwork for the modern corporate medical model. Healthcare transitioned from a localized community service into a high-margin, consolidated industry dominated by private equity firms, pharmacy benefit managers, and regional hospital monopolies. Between 1999 and 2023, the cost of employer-sponsored health insurance increased by more than 300%. The federal government attempted to address coverage gaps with the Affordable Care Act in 2010, expanding access to insurance markets, but the underlying pricing mechanisms remained untouched. Private insurers continued to raise premiums, deductibles, and co-pays, while pharmaceutical companies leveraged patent extensions and pay-for delay agreements to shield life-saving drugs from generic competition. Housing followed a similar trajectory. For generations, home ownership served as the primary mechanism for wealth accumulation among middle-class American families. However, the mortgage-backed securities boom of the early 2000s and the subsequent subprime financial crash of 2008 completely restructured the housing market. When millions of homes went into foreclosure, federal bailouts stabilized financial institutions while leaving neighborhood housing stocks severely depressed. Private equity firms and institutional asset managers recognized an unprecedented opportunity. Armed with near-zero interest rate loans from the Federal Reserve, institutional investors bought up distressed single-family housing inventory by the tens of thousands. Companies like Blackstone and Invitation Homes acquired vast portfolios of residential real estate, converting affordable starter homes into perpetual rental yields. Between 2010 and 2020, institutional capital transformed housing from an attainable asset into a financial product, locking millions of young families out of equity building forever. The geographic trap closed further as state and local tax structures shifted. To compensate for declining federal support for infrastructure and public services, municipalities increasingly turned to aggressive revenue generation, raising sales taxes, property taxes, and utility fees. Simultaneously, major urban centers saw commercial density crumble under changing work patterns, eroding local tax bases while municipal expenditures on law enforcement, emergency response, and public maintenance continued to climb. This structural evolution created a stark divergence. On paper, macroeconomic indicators showed historic stock market highs, robust gross domestic product figures, and low headline unemployment. On the ground, the actual cost of living, basic requirements, housing, healthcare, childcare, higher education, and nutritious food escalated at rates that far outpaced official inflation metrics. The system achieved maximum corporate efficiency by extracting maximum financial yield from its citizens, creating an environment where even a household earning $150,000 a year was often one major medical emergency or layoff away from financial insolvency. The historical trajectory is clear. The economic architecture of the United States was gradually re-engineered over 4 decades to optimize for capital efficiency rather than human retention. When a nation's legal, financial, and healthcare systems converge to make stability unsustainable for its core productive population, migration ceases to be an ideological statement. It becomes an economic necessity. The structural strain created by 4 decades of economic re-engineering is now triggering localized systemic failures across major American institutions, municipal centers, and regulatory bodies. The reality on the ground in 2026 is defined by a series of compounding conflicts where public policy, corporate consolidation, and decaying infrastructure directly intersect, producing conditions that actively force out skilled professionals and stable families. In major urban centers, municipal budget crises have reached a tipping point. The commercial real estate collapse, accelerated by persistent hybrid work arrangements, stripped cities of vital property tax revenues. In New York City, commercial office vacancies remained elevated above 20%, resulting in a multi-billion-dollar cumulative tax deficit for the municipal government. To cover operational shortfalls, city authorities reduced spending on public sanitation, park maintenance, and non-emergency services, while simultaneously raising transit fares and property tax assessments on residential buildings. This dynamic accelerated the outflow of middle and upper-income households, shrinking the tax base further and leaving remaining residents to fund diminishing services at higher individual costs. A parallel crisis has unfolded within the national healthcare delivery system. Following years of hospital network consolidations, rural and suburban regions across the country faced widespread medical care deserts. Over 140 rural hospitals closed between 2010 and 2024, with dozens more reducing emergency and obstetric services. In metropolitan regions, private equity ownership of healthcare groups led to aggressive staffing cutbacks. Emergency room wait times escalated nationwide, with average door-to-doctor times exceeding 4 hours in major trauma centers. Physicians and registered nurses, faced with mandatory overtime, liability exposure, and administrative burdens imposed by billing management software, began leaving clinical practice in record numbers. According to federal labor data, over 300,000 healthcare workers exited the clinical workforce between 2021 and 2025, triggering acute shortages in emergency medicine, primary care, and pediatric specialties. Educational systems have experienced similar institutional deterioration. Public school districts in states including Texas, Florida, and Missouri faced severe teacher shortfalls, leading to the implementation of 4-day school weeks in over 900 school districts across the nation. To fill staffing gaps, multiple states lowered credentialing requirements for instructional staff, allowing uncertified personnel to lead classrooms. Concurrently, public university tuition continued to outpace core inflation. Total outstanding federal student loan debt reached $1.75 trillion, with default rates among borrowers entering repayment climbing despite repeated administrative deferments and income-driven repayment restructuring attempts. The housing market conflict escalated as supply failed to meet structural demand. Strict municipal zoning laws, elevated financing costs, and material cost inflation restricted new residential construction. According to industry data, the United States maintained a housing deficit of approximately 4.5 million single-family units. Institutional investment vehicles continued to acquire existing housing stock in Sunbelt metro areas, taking up to 25% of starter homes off the consumer market in cities like Charlotte, Tampa, and Phoenix. This institutional dominance pushed median home prices beyond 9 times the median annual household income in major markets, compared to historical averages of 3 to 4 times income recorded in the late 20th century. Public safety concerns shifted from isolated criminal statistics to structural urban decay. Commercial corridors in mid-sized and large cities reported sustained elevated levels of retail theft, prompting major retail pharmacy chains and supermarket corporations to close hundreds of urban locations nationwide. The loss of urban retail infrastructure created vast pharmacy and food deserts, leaving urban residents without access to basic goods. Municipal transit authorities in cities such as Chicago, Philadelphia, and Los Angeles reported reduced ridership figures driven by concerns over public safety and unreliable schedules, leading to service cuts that further eroded transit utility for daily commuters. Regulatory agencies responsible for consumer protection and environmental oversight faced operational constraints. The Environmental Protection Agency identified over 9,000 public water systems across the United States containing dangerous levels of per- and polyfluoroalkyl substances, commonly known as PFAS or forever chemicals. The estimated capital expenditure required to update municipal water treatment infrastructure nationwide exceeded $100 billion, a cost passed directly to local taxpayers through escalating municipal utility rates. In regions prone to extreme weather, property insurance markets collapsed entirely. In Florida, California, and Louisiana, major national insurers cancelled hundreds of thousands of residential policies or raised annual premiums by over 100%, forcing state-backed insurers of last resort to assume unprecedented financial liabilities without adequate reserve coverage. Operate employment practices adapted to economic uncertainty by shifting away from traditional employment contracts. The expansion of gig economy frameworks and contingent labor agreements extended into white-collar professions. Engineering firms, technology corporations, and media companies increasingly relied on project-based contractors, eliminating health benefits, paid leave, and severance obligations. Automation and artificial intelligence integration led to rolling corporate restructurings, eliminating entry-level analytical and administrative positions across financial services, legal sectors, and corporate operations. This combination of rising fixed operational costs, deteriorating public infrastructure, failing healthcare accessibility, and diminishing job security created an environment of perpetual friction for working households. The mechanisms that once guaranteed middle-class stability have turned into friction points that extract resources without delivering reliability. For those with international mobility, remote capabilities, or portable liquid assets, remaining in this environment increasingly represents an irrational financial and personal strategy, driving the accelerated migration figures now recorded across international borders.